Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And this is Medicare Moments with your host, the one and only Toni King. Hi, Toni King.
How are you doing, Jim? And I need to let you know, I am exhausted today because Medicare's annual enrollment period is just something I have never experienced before. I've never seen the changes that Medicare is doing. We have no idea how 2025 is going to be. Don't you think, Jim?
I think based on what you've said, and I hear it in your voice, and I know you've been burning the candle, as they say, at both ends, staying up late at night, looking for stuff.
I mean, it's not good, and I don't care what they say, it is not good. And Friday, when they released what the Medicare numbers are, it was a whole different experience. That I've been doing this for 15 years. And this was my first time to experience what we're going to talk to them about, because the changes with Medicare are going to be devastating in 2025. So people better get ready.
And what this means is, like Toni has said so many times before, you have to be proactive. You have to think about Medicare and how it impacts you personally, and make sure that you research and get all of the best information, which is why Medicare Moments, your favorite Medicare podcast, is here. So, Toni, today we're going to go to Memphis, Tennessee. Carolyn there writes you this email. Okay. In the new Medicare and You handbook that I received about a month ago, I cannot find what the 2025 Medicare costs and premiums will be. I would like to know this information because I've been diagnosed with a heart condition and will need to undergo several heart surgeries next year. I've looked online and cannot find the cost. Do you have any idea what the 2025 Medicare cost will be, Toni King? Do you?
Do I? Yes, I do. And you want to know why? Because They finally released them as of November 8th. The Medicare costs for 2025 were finally released. And people need to realize that whenever you get your Medicare and You handbook, it comes in the mail, okay? You got one, I got one, because we're on Medicare, right?
Correct.
They have to put it out by October 1st. These books are printed in June. They don't know what the numbers are in June. They have no clue. They know what Advantage plans and they know what prescription drug plans could be at that time. But to know what the numbers are going to be, what the cost of prescriptions, what the copays and everything are, they have no idea what it's going to be. So right now is Medicare's annual enrollment period. That's AEP. That is just for changing your prescription drug plan or your Medicare Advantage plans. That's what we can say. So I have good news for Carolyn, because on Friday, November the 8th, after 2:00, they finally released the numbers. I've been waiting for them. I've never seen them come out quite this late, but they released the costs for Medicare Part A, the costs and the copays for Medicare Part B, and they released the premiums, but not all the premiums. I've never seen that.
So that's where we are at this moment. So Toni has that information for you, and we'll be back and give it to you right after this important break.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Medicare Moments is the podcast. Toni King is your host who has all the information, and we're talking about Medicare year 2025, costs, premiums, deductibles, everything we know so far. And Toni's made it clear we don't know everything, but we have some information that's very important for you to hear. Right, Toni?
That's right. We know what the copays are. We do not know what all the premiums are, and we can discuss it. Okay.
So why don't we go on? Let's start in Part A.
Okay. We got the A, B, C, and D. We'll start with Medicare Part A. And Medicare Part A is your inpatient hospital stay. And in 2025, it's going to increase by $44. It is going from $1,632, which is what it is this year, and it will go up to $1,676. But you know what, Jim? It's not just once a year. Your Part A out of pocket or your Part A deductible is 6 times. That recycles itself every 6 times. And you have to work 10 years or 40 quarters to get Part A at no cost. If you're someone who never worked, maybe you're a wife who stayed home, or you're a husband who stayed home and took care of the kids and you never worked, then you have to get on your spouse's insurance, your spouse's Medicare. That can be confusing. That's what we do at the Toni Says office. We sit down and customize a plan for you. So like I said, Part A is 6 times a year. So every 60 days, this thing recycles itself. And just to think that in 1965, July 30th, 1965, when LBJ flew to Independence, Missouri, the cost was $40 for the whole thing once a year. The premium was $3. We've come a long way. So Part A also covers skilled nursing, and skilled nursing went up a little bit this year. You get 100 days of skilled nursing. Days 1 through 20 are 0. Days 21 through 100 is $209.50. So it went up just a little bit for this year. Okay. Where do you want to jump into next?
Well, I think next we should go to Part B, costs, medical costs. So what is the new 2025 Part B medical doctor deductible?
Well, it's going to go up by $17. This year, it is $240 deductible. Next year, it's going to be $257. So it's going up by $17 starting January 1st. And after you meet your deductible, then Medicare pays 80%. And you have to pick up 20%. That's where Medicare supplement would come in if you want to work with original Medicare. Medicare Advantage plan is a whole different ballgame. So you need to research that and see which one you want to go with if you're going with an Advantage plan.
Okay, now the Part B premium, is that going up in 2025, Toni?
Now, what do you think?
I think every year it does inch up.
This year, the Part B premium is $174.70. It is going to go up by $10.30 to $185 is what the premium is. Here's where the problem is. I've never seen this before in my Medicare life. When they released the numbers on Friday, they only released the $185 for people whose income is $106,000 or less as an individual, or $212,000 or less as a married couple. They only released that. They said that they didn't have the numbers for anybody whose income is higher under Part B. So it says the Medicare Part B IRMA, that's one of Medicare's little girls, IRMA, premiums for higher incomes earners were not released on Friday. I don't know what the premiums are yet. I have not looked as of this morning, which is Monday, to see if they've released them. But they had not released it as of Friday, what the other numbers are. They have for the prescription drug plans for Part D. They released the IRMA, but not for Part B, as in boy, for Medicare's Part B.
So we're still waiting for that to be released, and there must be a reason why the government hasn't released it, but we'll probably never know that reason. Part D covers something that a lot of people deal with on a day-to-day basis, and that's prescription drugs. And so how is that going to be impacted in the year 2025?
I don't really think anybody knows how it's going to be impacted because we haven't experienced it yet. The big change is coming. So this year, your deductible was $545. Next year, it's going up by $45 to $590. And they're capping the cost at $2,000. So once the true cost of your drugs has grown to $2,000, then Medicare will pick up paying for that cost. The donut hole is going away. But we just have to experience it. We don't know what all the costs of the prescriptions are. We don't know what the changes are. All I can tell people, if you've got to look at a Part D plan, you need to go online to Medicare.gov and look at your current prescription drug plan and see what it's going to. Some of the companies that we have in the Houston area have gone from $9.80 to $43. They've had a 400% increase. And another company has gone from $25 and so many cents up to about $60 or $63.
And that's monthly. That's monthly, right?
Monthly. It had a 250% increase. So some people, it depends on what your prescriptions are, whether you're on Xarelto or Eliquis, or you're taking cancer meds or Parkinson's meds or Stelara, anything you see advertised on TV, they're all going up. And you really need to go to Medicare.gov and compare. Don't just assume that because you're signed up with XYZ prescription drug plan that it's going to be your best fit for next year. Your prescriptions may not be covered. This is very, very, very serious.
Well, in every podcast, Toni tries to give you the most information possible to help you navigate your way through Medicare and do it the right way. And to support that further, Toni has her website, which is tonisays.com. That's TONISAYS.com, because Toni's a girl, right, Toni?
I'm Toni with an I and not a Y because I am a girl. Okay.
Yes, Toni has her books there. We have the webinar there that you're going to want to take advantage of. We also have a place for questions. If you want to email Toni a question, info@tonisays.com. That's info@TONISAYS.com. And you can call her on her 24-hour a day, 7-day a week Medicare hotline, 832-519-8664, 832-519-8664. Now, no one's going to probably answer it at 2 a.m, but you'll get in queue. And then as Toni's team gets the messages, they'll get back to you. We know this is a different kind of a year, and Toni wants you to go to her website to see what she just said, because it'll be posted on her website.
People need to realize that effective January 1st, the donut hole is going away. And your out-of-pocket will be $2,000. This starts over every year. January 1st of every year, this starts over with a new prescription drug plan, a new deductible, and a new maximum out-of-pocket. Who knows what it's going to be next year?
We don't, but we also know this year, if say you go through that 2000 in January, which you, Toni King, said some people can, you can arrange with Medicare for a payment plan throughout the year to divide that expense so you're not burdened with it all in 1 month. Is that true?
That's what I understand. And you've got to contact Medicare.gov or contact your prescription drug plan to get signed up for Medicare's new prescription payment plan. So have fun with that. Because a lot of them, when you do these call centers and you're calling these insurance companies, you're getting the Philippines and you're getting China and you're getting Jamaica. Well, honey, they don't even know, they do good with insurance over there. So take your time. If you don't like what they have said, tell them you want to go back to the U.S. and talk to somebody with their company that's in the U.S.
And that's why we have ToniSays.com. That's ToniSays.com. It's filled with information that can help you. And if you hit a wall and have a question, again, Toni welcomes your email, info@ToniSays.com, and also 832-519-8664. Toni really welcomes all questions and does her best to answer in a timely fashion. So, Toni, anything else to say before we call this?
I would say that my favorite saying is with Medicare, it's what you don't know that will hurt you. And if you're by yourself and maybe you're older, you can't navigate the computer or whatever, get your kids involved. Because when you have a serious situation, they're going to be the ones that help you. I mean, seriously, some people just, they've got to be careful with answering the phone. The scammers are coming out in droves. And they know how nice everybody is. If you have somebody that calls you and they ask you for your social security number before you ever get started, don't even be nice enough. Hang up. Scammers are just going to be a dime a dozen.
Okay, well, thanks for listening to this edition of Medicare Moments. And by the way, we're recognized by Feedspot.com as one of the top Medicare podcasts in the good old US of A, all across the fruited plains. And that's because of Toni King. So, Toni, thanks for taking time to do this today.
And that's because I put America first. America needs to be first. The people that are on Medicare, their kids, and everybody need to be first. It's not about the insurance companies and it's not about the prescription drug plan. It's about you making sure that what's going on is accurate for the person on Medicare. So you can call me, you can email me, you can visit the website. I'm here for you. Well, thank you, Jim. I appreciate it. You go have a good Thanksgiving with your family. And I just want to say, God bless you. God bless America. And we are in the best country there is. Amen. Right? Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little known facts I've learned over the past 20 plus years. I put Medicare into people terms. And I want to help you personalize your Medicare because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.